the movement that we're all familiar with is a concentric contraction. That's a muscle that is contracting and shortening. And that results in a reduction in the joint angle. You can see pretty large there, and it gets smaller as I contract.
Hey everyone, my name is Dr. Nick Housley with Motus Nova. I'm a licensed neurophysical therapist and neuroscientist helping brain injury survivors understand how to make functional gains after their injury. I hope this video helps you in your recovery.
Tell me about your first impressions so far.
Well, it's quite favorable. My problem, my hand seemed relatively strong last night. I could do most of the stuff for the time that y'all allot. And I'm going to be interested to see with the foot stuff, because that seems to be a greater weakness.
Okay, so if I'm understanding you correctly, it sounds like your lower extremity is more challenged right now. So
that's correct.
Oh, understood. Okay. Now, with respect to your walking right now, are you up and walking?
First thing in the morning, my back kills me, and so I use a cane.
Okay.
But as the day rolls on, that back loosens up, and I can walk, but my foot hits flat. It doesn't go heel toe; it hits flat.
Yep. And actually, so James, this is a little bit of some interesting background into how that works. There are types of movements. I don't know how much of this you want to get into, and you can, of course, opt out for any of this explanation. But there's some types of movements that our muscles can do, and we can kind of break them down into two kind of categories. Well, we'll say three categories. One of them is called isometric. And that means that our muscles are contracting, but my joint angle is not actually moving at all. Okay. So for instance, if I were to keep my wrist at my elbow here at 90 degrees, and I just contract my bicep and my tricep, I'm getting muscle activation, but my joint angle is not moving. Now,
hey, if you're finding this video helpful, please hit like and subscribe to help other brain injury survivors learn how Motus Nova is changing neuro rehab.
The movement that we're all familiar with is a concentric contraction. That's a muscle that is contracting and shortening. And that results in a reduction in the joint angle. You can see pretty large there, and it gets smaller as I contract. That's called the concentric movement. The movement that you're talking about is the opposite of that, in which case there is an eccentric contraction. And that happens when my muscle is contracting, but it's actually lengthening. Now, well, how does this happen? That seems a little bit strange. How would I contract and then lengthen? Well, this is where gravity comes into play and our body mass comes into play. And this is actually a deceleration effect for walking. And so you got to imagine each step that we take, our heel hits first initially. And then what has to happen is we have to slowly lower our foot down to the ground. This is just in preparation for us to walk forward. Now, what happens after a neurologic injury is that ability to slowly lower that muscle, that foot down, which is controlled by the muscle called the tibialis anterior, that actually is reduced, that capacity is reduced. This not only has that problem of the kind of foot slapping, if you will, but it also might have an expression in drop foot. So when you're trying to lift up your foot to walk, you may notice that it kind of drags a little bit more. And that's really really problematic too. Now, because you're very early in your recovery, I will just alert you to some of the things that you may find yourself doing to prevent that. You may find that you're going to circumduct rather your hip. I'll explain what that is here in a second. So normally, I'll just walk here for a second. If you walk pretty much straight in line like this, forward here. But if I am not able to actually bring my toe up to the sky, I may find that I'm going to kind of move my hip around like this. And what that effectively does is that effectively gives me a longer moment arm for if my toe is pointing because I can't control it. It gives me some extra leeway so I don't trip. I think for you, the reason I'm bringing this up is if you're having some back problems, doing a hip circumduction process will actually cause some additional strain on your back. So I would very much be cautious of those compensatory things that may kick in for you. So just be cognizant of that. That's something to be aware of. For you is you might need to find some additional hip flexions. You might need to bring up your hip a little bit more. But all that being said, what you have coming to you, the Motus Foot, is really designed to help with that. It's really designed to help prevent foot drop and really strengthen those muscles that help control that deceleration. So this tool that's going to be coming to you is going to be very helpful for that function. So I'm glad you have that.
Thanks for watching this video. If you have questions or would like to speak with me about how you can make functional gains from home, call or text me at 404-939-3476 or visit motusnova.com/contact.